Today with the Grameen Foundation, and we are in Ghana, and we have your team members of the Grameen Foundation, and you're doing something with mobile. Could you explain further?
My name is David Hutchful. I'm with Grameen Foundation, a technical program manager for Motec.
Hello, my name is Jacqui Larsen, and I'm the country director for Grameen Foundation in Ghana. And we're here in Ghana supporting the Ghana Health Service introduce and implement a mobile technology to improve community health. The ultimate aim is to reduce maternal and child mortality rates. We're supporting the Ghana Health Service to achieve the Millennium Development Goals 4 and 5, which is to reduce maternal mortality and improve child health.
So how do you do that on the field, concretely? Can you explain the process? And I can see you have, there's a poster here which explains a bit. So we could describe that.
Yes, okay. Really what we do, we have a mobile technology intervention which is offers two standalone services actually, and then one which can only operate if the other two services are in existence. The first one is called Mobile Midwife, and that's where basically women will receive a message every week in their local language targeted to their week in pregnancy or to the age of their child. And that is information that women have never really had before actually. And it's health information which is maybe about nutrition or how to take care of themselves or what to expect during their pregnancy, or it could be informing them or advising them that they need to go to their health center for key, important care during their pregnancy at the specific times. Improving
the number of appointments and
yes, it increases
regular care.
It increases demand and take-up of services. So for antenatal visits, maybe for immunizations, for malaria preventative services, those kinds of things that are really important for women to get when they're pregnant. Those messages are encouraging women to take up those services, and actually nurses are telling us that women are going to the clinic as a result of getting the messages. So that's good.
And what are the other solutions?
The other service is, or the other part of the intervention is a data improvement aspect. So all of the nurses in rural community health compounds have a mobile phone.
You give them a mobile phone?
We give them a mobile phone. It's a very cheap phone. It's a $40 phone. It's Java enabled, and on it is an application which is basically something that we've designed based on MRS application, which is an open source medical record system. And they enter into that mobile handset all the information about clients that come into their compound, including the pregnant women. And that information is then uploaded just via an SMS message and sent to our server, central server. And from that we can generate monthly reports for these nurses in order that they can see what the number of clients that have been coming through, what they've been receiving. But the most important thing is that it's a really good time-saving device for the nurses, because these reports they used to have to do very manually, basically.
On paper.
And on paper. And that would take them maybe 4, 5, 6 days to do that, depending on how busy their clinic was. So that's 4 or 5, 6 days taken out of providing healthcare, which they can now offer back to the community who they're serving.
So you're saving them at least 4 days per month?
Yeah,
or,
at least, yes.
Completing all the questions and completing the records,
That's right, but it's not
and
just
then they can put this time to do more care, basically.
Yes, they can give more care to their community, but the other aspect of it is not just that it's a time-saving device, it's also improving the data quality. So all of that data can be aggregated, it backs into and is part of the Ghana Health Service Health Information Strategy as well. So it's aligned to that, and we're working very, very closely with Ghana Health Service to make sure that
and they can make better decisions out of the data.
Exactly. So much better policy decisions, much better planning decisions, and also the nurses themselves can look at those reports with their supervisors. This is our ultimate aim. We're not doing that at the moment, but it would be that nurses can actually get a better understanding of the needs of their community so that they can organise themselves better to serve those needs. So there's a number of different dimensions. And then
many benefits.
A lot of sort of, there's some core immediate direct benefits towards helping achieve the Millennium Development Goals, but there's a lots of sort of added value which is about helping improve the system in which nurses are operating in and women receive their care.
Okay.
But there's one more that I have to tell you, which is the third one. So there's two that are kind of standalone, and then there's one third element to it, which is where nurses every Monday morning would receive a list of women who should have come for care but didn't. They're called defaulters. And normally those women can very easily get lost in the system. If they just don't come for care, then they're probably not going to get that care. But with this system, the nurse gets the name and contact details of that patient, and she can go out into the community and follow up. And in addition, each woman will get a reminder on her phone to say, please remember your antenatal visit's due, or your child's immunisation is due next week, go to the clinic. So we're encouraging people, and then we're also following up to sort of scoop up all of those women that may have got lost otherwise, and then nurses can follow them up.
Okay. So how far have you been with this project? It's a pilot right now?
It's a pilot project. It's a 2-year pilot project, and we're about 18 months into it. So we're implementing and have been implementing the mobile technology in one district in Upper East region in Ghana now for, since July last year, so that's about 8 months.
What have you, in terms of, have you experienced any issues? Everything is going well, or what are maybe the obstacles and the problem you've encountered?
Yes, I mean, we've experienced, lots of challenges. I mean,
what are the key ones, especially to do with technology?
I think in relation to the technology, I'll probably ask David to answer that. I mean, there's a couple of challenges.
Yes, David is
with technology, there are a couple of challenges. One, we had to understand how to develop an application for a community that didn't have high literacy levels. So by default, we had to use a lot of voice. And then because we're using mobile phones, you end up with a lot of issues where the network connection is not strong, or because we're very close to the Ghana border on the north, we had people who were on the network from Burkina Faso, which is north of us, so we couldn't reach them. And so trying to understand how to deal with that. And then also how to design the application on the phone so that it fits into how the nurses work. In terms of their workflow. We didn't want to make it too complicated, but we also wanted to be able to collect all the information we needed. And so it's been a back and forth sort of iterative design process, trying to understand how do the nurses work, what is the easiest way to create this, how do we limit or increase data accuracy and limit errors. And so those have been kind of challenging. And then of course working with telco companies to understand what we're doing and to get them on board and to have them also contribute to the effort so that the cost prices are kept down and all that. And so
have they been delivering to their promises in terms of network and mobile network? And so
you mean the reliability of the connectivity?
Yeah, because that's key to your.
That's key, and in a lot of the districts we're working in. I mean, the one district we're working in, a lot of the different areas, it's been great. There are a lot of there's some areas that are really difficult to get to, and the extent of their networks is not that strong there. But we have a couple different telecom companies in the company, and between them they seem to cover it well.